Hello, everyone. On behalf of Fordham's Office of Alumni Relations and its Graduate School of Social Service, I want to thank you for attending this webinar. My name is Sarah Hunt-Munoz, and I am the Senior Director of Strategic Initiatives in the Office of Alumni Relations. We are thrilled that so many of you could join us today. We felt it was of the utmost importance to shine a light on the inequality that has surfaced within the context of the COVID-19 pandemic. While we had no idea that today would be singled out as a day of reflection for the academic community, we are fortunate that the two coincide and hope that this event provides a framework for your own reflection and action. Dr. Popescu has prepared an informative and thought-provoking talk and encourages you to ask questions throughout. I will keep an eye on them as they come through the Q&A chat feature, and we'll get to as many as we can. Please take a moment to locate the Q&A button on your devices in case you are inspired to use it. Dr. Marciana Popescu is an associate professor here at Fordham University's Graduate School of Social Service since 2006. She is representing the International Association of Schools of Social Work and has worked with the UN NGO Migration Committee since 2018. She is also participating in the UN NGO Committee on Mental Health, particularly focusing on work regarding migration and mental health. Dr. Popescu worked in international development and studied various aspects of the field since 1995. Between 2008 and 2018, she conducted study tours with students in the Dominican Republic and Haiti, focusing on human rights violations, statelessness, post-disaster displacement, and forced migration. She worked as a consultant for UNICEF from 1998 to 2000, and again in 2011. She collaborated with the Soros Foreign Open Society Foundation as a project director from 1998 to 2000. Dr. Popescu is also involved with several organizations working on human rights issues. She is currently a co-chair of the Human Rights Committee in the Council of Social Work Education, and she is coordinating advocacy efforts focusing on the rights of migrants at the New York City and New York State level, as well as at national and international levels. We are delighted to have with us Dr. Marciana Popescu. I'll start things off with a question. Dr. Popescu, it's been 3 months of social distancing, sheltering in place, working remotely. What would you say are some of the gravest impacts of the COVID-19 pandemic?
Not all in the same boat. So when we're talking about the most vulnerable, we have to face the structures of inequality, discrimination, oppression, marginalization that were there all along. We just normalized them. So people that left, let me just back up. One major issue that we are dealing with that directly affects our mental health, and I'll talk about that later, is uncertainty. What this pandemic created is a major level of uncertainty. Well, but there are population groups that lived with uncertainty as a constant in their lives. So when uncertainty is a constant in your life and the new crisis happens, we are not talking about a public health crisis anymore. We are talking about a pandemic. And I'll get to, not a pandemic, a complex emergency. And I'll get back to this in a second. But I want to point to some population groups that we see are more affected, disproportionately more affected by the pandemic. Of course, we talk about people with lived experiences of poverty. You know, people living in poverty already faced uncertainty, already had little to no access to the few existing services, because in the United States, at the very least, we do not have a safety net, already dealt with pre-existing conditions. So of course, you know, already they were in precarious jobs. So of course, you know, the pandemic hit them more than it hit other groups. We're talking about the homeless population, and I think we should dedicate an entire webinar to what is happening with the homeless population, which when you're looking at the numbers, they might not strike us as the population that's most affected. When you look at the proportions, they have the highest rates of infection, the highest rates. And of course, you're talking about the basic measure of protection that we are encouraged to take during this pandemic. When you are homeless, you do not have access to these basic measures of protection. If you are in a shelter that is overcrowded, will you be able to distance yourself? If you need to wash your hands, but washing hands facilities are not that easy to find, will you be able to protect yourself? We are already dealing with a population of homeless people, a population living in homelessness that have health conditions, they have mental health conditions, they are aging. So of course, they are the population that is deemed at risk, at high risk when it comes to the pandemic. If you are not in a shelter and you live on the streets, where would you wash your hands? Where would you go for information? Can you access testing? Do you know that you can access testing? Not to talk about all the other issues that are still in this population's lives, right? And then you have the population I will talk mostly about today, and that is the population living with an experience of forced migration. Now, you might have noticed that I'm trying to use different terms when I'm referring to population living in some sort of marginalization situation. Why? Because I think one lesson that I learned during this pandemic is that it is time to step back and to look at the categories we create, sometimes to protect people, but that become labels. Taking away visibility, taking away humanity, taking away rights from entire groups of people. So people coming from a forced migration background, of course, will be most affected. Why? Because they were already in precarious situations. They did not feel supported or protected by the current policies we have. They lived with uncertainty. They live with uncertainty on a daily basis. They have little to no access to any kind of safety net provisions that we have. They are conflicted by being basically like losing ground here while they lost communities in the countries they came from, right? They are trying to support their families here in jobs that are precarious, in jobs that expose them with little to no protection in terms of labor laws applying to them. And they are trying to protect families abroad by sending remittances that all of a sudden are cut because now they lost their jobs. So this is just a few examples, but let me please add two more things. I was saying that when we're talking about this pandemic, we tend to refer to it as a public health crisis. I did prepare a funny slide, not so funny, that I wanted to share with you actually, if you give me a second here. Okay. So, we're looking at this as a public health crisis, right? And we try to now understand, okay, what would be the mental health impact of this crisis on everyone, and then on very specific population groups that are already marginalized, already less visible, already living with a normalized experience of discrimination and oppression, right? And what we're seeing is that their histories, their context prior to the pandemic is actually adding to the mental health impact of the pandemic. But when you're really thinking of these groups that I mentioned, we are moving from a public health crisis into a complex emergency. In the humanitarian literature, complex emergency is the type of emergencies that results by the compounding of multiple crises with new crises being added while past crises have not been resolved. So if you're really thinking of all the issues that we are dealing with currently and all of a sudden became visible to us, you can start understanding what I mean. Yes, we have mental health issues, we have healthcare issues in this country because the healthcare system was not properly equipped to deal with the pandemic. The healthcare system does not respond to the needs of all. Healthcare is not framed as a right. We have immigration restrictions in this country that create barriers to accessing services, to accessing jobs, to participating in the society. We have major job loss, and we already talked about that. And I want you to think about major job loss as it affects individuals and families. Major job losses as it affects the economy. We have, right now, we are in the midst of one of the biggest protests that is way overdue on police brutality, but it's not only police brutality we're talking about. It is the structures, the institutional racism that is so ingrained in this society, right? But it's now becoming more visible. And hopefully we will start denormalizing some of the racist structures and policies and practices that we have in place. We have food insecurity. Well, probably about 2 weeks before this crisis, before the start of the pandemic, right? So at the end of February, we were looking at data on food insecurity among college population, for example. And then we started trying to see if we can find any data on food insecurity on the migrant population, particularly asylum seekers and undocumented population. And there is not enough that goes talking like about the needs in the academia for reform, right? What do we research? But that became exacerbated. Why? Because the responses that we have to food insecurity in this country are linked to specific institutions, and those institutions became inaccessible during this time. So how do you deal with food insecurity when you counted on the school lunches, for example, and now schools are not in session? We switched very quickly to remote learning, and this is great. Remote learning is great, yet it's not so great because it uncovered layers and layers of inequality, issues of equity in the public education system, right? And right now we are dealing with that, trying to see how can we make sure that next year we will not have an entire population of children totally behind their counter, their peers, because of already existent inequalities. And then we are dealing with an increase in violence and domestic violence in particular. There was an article in New York Times this morning that talked about the fact that there is a significant drop in the reports of child abuse. And that, unfortunately, is worrisome because it doesn't necessarily mean that we have less child abuse. It means that we have no way of monitoring that. Children are not in school. They do not have any support systems around them to protect them from violent family environments. So, this is just, like to give you a taste of what this crisis should be defined as. Because when we defined it as a public health crisis, the response at the policy level is to create public health policies that will contain this crisis. But when we are looking at it,
if I could just pop in for a second, great question come in, just touching on what you were talking about. What is the current status of the shelter system? Since COVID-19 has increased the rates of domestic violence, how has access to domestic violence shelters been impacted? Can you speak to that a little bit?
Absolutely. And that is another topic that we should take on for a different webinar because it's so much to speak about. So when we're talking about shelters, domestic violence shelters, have to really limit their activity as well because they cannot guarantee social distancing. So people already in the shelter are being affected, right? Will they call to the shelter? Will women be able to call to the shelter and the shelters to respond? Well, there are restrictions there, right? Because all of a sudden we are in this pandemic mode in which you cannot have people congregated. But this country still has a big problem with really addressing congregating people in homeless shelter, in domestic violence shelter. So you still have, shelters in existence, shelters that try to provide services, but they do not have the resources to provide proper services while contributing to containing and mitigating the pandemic. So when you're having, and when I'm talking about that, I want you to think of resources that are provided in terms of hygiene and the right hygiene that is needed, in terms of healthcare and mental health care needs. Like, okay, in a shelter, if someone gets sick, who will they rely on? How can they, be linked to healthcare services? All these are not functioning because we are not prepared. The healthcare system is overwhelmed. The shelter system is overwhelmed. And who's suffering? People that depend on these services as the only places, for many, where they can shelter in place. But those places are not secure. One more thing, and I'll leave the homelessness component of my talk aside because that was not the topic for today. It is very interesting if you try to think of some of the policies that were put in place to actually mitigate the pandemic. One of them in New York City is the closing of the subway system between 1 a.m. and 5 a.m. Now I want you to think, who is affected by that? Who depended on that subway system? when homeless shelters are being overcrowded, and the Coalition for Homelessness actually raised this issue, when homeless shelters are being overcrowded and people choose to, and I would take that choose, the choice element with a grain of salt, because there is limited to no choice in such circumstances. They stay on the streets. You know, having a place to go, to wash your hands even, becomes extremely important. Also, having a place to go while the streets are being swept, you know, cleaned, so we can make sure that streets are properly cleaned. It's another issue. But when we design these policy responses, we are acting in a crisis mode. We are not including the populations directly affected, and we have very limited targeted responses that are not always effective as they should be. Did I answer your question?
I think so, yes, thank you.
So I'll stop my sharing now. But the other element I wanted to say is, like, because we will talk here about mental health, right? And we'll talk about, okay, these are the populations that are being affected. We are dealing, I hope we agree, we are dealing with a complex emergency that addresses marginalization, or should address marginalization at the policy and practice level. And now, when we start thinking about mental health, you know, what this crisis did, it really brought to light the layers of inequality and injustice that are ingrained in US public and social policies. And when you start thinking about mental health, you see that even more clear. So just, you know, bear with me for a second. So let's think of mental health in the context of privilege. People can afford to work from home. I am privileged. I can afford to work from home. I have a space where I can work. I am connected. My job is somewhat secure because it can continue remotely. People can afford to shelter in place and social distance, right? We don't like it. We fight against it, but we have the resources that are needed. So that lowers the anxiety, right? People can seek medical help preventively. If I don't feel okay, I can call my doctor, describe the symptoms. I have a doctor, I have health insurance, and I can seek medical help when needed, absolutely, right? People can work with schools and teachers to make sure that their children get the best of the education during this time of remote education, remote learning. And we have access, I would say too much access, to multiple sources of information where we can check what is happening all the time. And that has a major impact on our mental health, because although we're all stressed and anxious, you know, because if the economy is going down, we're all affected. If, you know, the virus comes back, we're all stressed. I don't want to diminish your, you know, stress. And there are different layers of stress we're dealing with, but we are dealing with all this in a context of privilege, and our mental health will be less affected. Now, just let me add this one other part. So now think of mental health in the context of marginalization, okay? So what does that mean? People might be forced to continue to work. You have essential workers, and the immigrant population is very present among essential workers with very little to no protection. They can, you know, they lose if they lose their jobs, they have absolutely no protection in place. There is no place to shelter, right? So the homes, the safety of our home is not always safe, okay? So their homes are not secure. They might be in overcrowded living situations with multi-generational households, right? So of course that becomes an issue. Accessing healthcare, it's a major, major issue. When you talk about mental health care, you know, it's almost like the pink unicorn. Right? Can I access that? I was looking at the World Health Organization guidelines for, you know, improving our mental health during this time. And it is very interesting to see how much those guidelines are linked to the context of privilege, not the context of marginalization. There is little connectivity, little time to work and support your children through this remote learning period. Okay, which will affect the children, right? There is increased heightened insecurity and uncertainty. And of course, there is little access to information that is not always accurate and not always prepared for this particular population group.
You touched a little bit about immigrants, forced migrants, asylum seekers in particular. What would you say is the impact of the pandemic on their mental health specifically?
Okay. So, I was actually sharing with Sarah just before we started that it is a nice fantasy to think we can talk about the impact of the pandemic simply on the mental health of immigrants. And if you bear with me, I want to share with you another slide here. I am visual, so I'm using my discretionary power here to, share some visuals with you. So first of all, I wanted to actually contextualize why I chose to focus on this particular marginalized population. It is because we are seeing that they are disproportionately affected by the pandemic. Just looking at New York, all but 2 of the 20 areas with the most confirmed cases in New York host over 30% of foreign-born residents. And the top 2 zip codes affected by the pandemic have 60 to 67% foreign-born residents. And I don't think like many of the undocumented are counted in this, and they are, even more affected. But the slide I wanted to show you is actually this one that basically starts contextualizing our conversation on the impact of mental health. So when you're thinking of the migrant population, and particularly of the forced migrants that are here either because they seek asylum or because they came to seek opportunities, they stayed, they are undocumented, right? So they are affected by multiple issues. First of all, they are affected by the immigration policies. And what we noticed is that there was a blurring of lines between immigration policies and public health policies in the context of this pandemic, leading to border closings. It's very interesting that none of our senators stood up to talk against the border closings that are actually keeping people in congregated settings, either in Mexico at the border or in detention centers inside the United States, and are actually violating the right to asylum and the right to the prohibition of return to their countries of origin, both of these rights being enshrined in international laws. And it's all done in the name of or justified by our attempts to contain the pandemic, right? So the CDC provision of March 20th, that I'll talk about a little bit later in more detail, is one example of such policy that was presented as a public health policy responding to the pandemic, the public health crisis. But actually, it does not work to mitigate the spread of the pandemic, on the contrary, but it does work to push forth very restrictive immigration policies. And then, of course, there are expedited removals that are facilitated by this new CDC provision, affecting even children. We have over 7,000 children that were, targeted by all these immigration laws, right? So then we have the context of health and mental health care in terms of availability. Is there, health care available? In terms of access, what are the barriers? And there are multiple barriers that the migrant population in general and the forced migrant population in particular are affected by. And utilization of services, even if I can access services, I might choose, if I am an asylum seeker, not to utilize them because I am afraid. I am afraid of the stigma attached to the virus. I am afraid that I might be expeditiously removed, deported back to my country. I am afraid that I will be away from my family and therefore not be able to care for them. So all that will prevent people from utilizing even the few existing services. And then, there is this whole issue of, income protection. People, asylum seekers might have received an employment authorization, might have been able to secure it prior to the pandemic and then have been able to work. And now are they still forced to work because they depend on that income, or they lost their job, and what kind of support do they have? If they didn't have an employment authorization, they are really in a very, very serious situation, right? In terms of our welfare policy is extremely restrictive when it comes to the migrant population. So access to any kind of safety net provisions are inaccessible to this population. And then, of course, people are not protected. They are representing many of the essential workers. We are talking about domestic help. We are talking about nursing home facilities. You have large presence of immigrants in these facilities. They are not protected by the law. They cannot and feel they cannot require protective gear to really help them go through the situation. And they will not require it because they don't want to risk losing their job. So with this in mind, we get to mental health. So when you're thinking of the impact of the pandemic on the mental health of forced migrants, you cannot think just of the pandemic, because there is an impact that's context-driven. People that are coming from a forced migration background have their migration experience that has a major impact on their mental health. There is a history of trauma. A history of trauma prior to coming to the United States continued here by restrictive policies, by uncertainty, by exclusion, by marginalization, right? So that affects, that increases your anxiety, that depresses you, that, triggers PTSD. Then you have a whole set of protection-driven impacts on mental health. Why? Because even the international protection mechanisms that we have in place, the categories I referred to earlier, are many times used to marginalize and exclude people. Oh, you are an asylum seeker, these are your rights. You are a refugee, these are your rights. So you can see like people that are coming with similar histories, similar stories of migration, similar experiences, they are placed in different categories based on very discretionary criteria many times. And therefore they get less protection, right? So the language that is being used, trying to protect this population, many times actually leads them to become more anxious, to hide, to go underground, to not want to access services, right? There is a disconnect between all these protection policies that should provide access to fundamental human rights and the lived reality, the lived experience of the migrant population. And then of course, on the top of that, think back to the complex emergency characteristic, right? That's where everything fits. We have the pandemic-driven impact, right? So there is a new crisis that lowers, or I should say, heightens the uncertainty, right? There is this public health policy that actually what it does, it stopped the asylum process altogether in the United States. Leaving people stranded. It's not enough that we already pushed people into invisibility by sending them back to Mexico based on a policy that is named migration protection protocols. That has nothing to do with any kind of protection. Now, we don't even have that because that policy still gave some hope. People had to wait in Mexico until their turn would come and they could have their credible fear interview and they could, hopefully go through the process. This new provision, the March 20th CDC provision, takes that away. There is no due process. People are sent back immediately. And actually, since the passing of the CDC order on March 20th, over 20,000 people were returned to Mexico. Some of them children, because all of a sudden, being a child does not confer special treatment. We're violating our pre-existing protocols. And we send children into detention centers in which they are, exposed to the virus, their mental health is being affected, and they are definitely not protected against the pandemic or against anything else. And of course, that creates an increased stress and level of vulnerability. We talked in 2008 after the economic crisis about increasing what was called death by despair, right? And it wasn't only suicide, it was a lot of substance abuse related death, right? I'm afraid we have to prepare ourselves to deal with this because people are desperate. People are losing hope. And in a time of crisis, if we are all, overwhelmed by fear, and if the policies we have in place are not contributing to any hope, then we cannot really secure the mental health and improve the mental health of the most marginalized population. I'll stop sharing now.
So you talked about children a bit, and we talked about homeschooling and remote employment in healthcare and no access to healthcare. The children that are living in these populations, who that's their day-to-day experience, you know, they're exposed to poverty and mental illness around them. Is this permanent damage? Do you think it can be undone once we're, you know, allowed to resume normalcy, or, you know, are they going to be in a bad way for a while?
Well, you asked a very, very critical question. And actually, again, you know, we have to think of the pre-existing condition in the context before the pandemic. I was actually talking to my students again before this started about the impact that the current migration policies at the global level would have on generations of children. So we have a full generation of children that only knew two experiences at most, right, in their lives. One was the experience of living in conflict and in conflict situations, and that has a major impact on mental health and on child development, right? And the other, it was the experience of migration, which is not helping, right? So already, you know, children that are, I would say, new migrants in the context of the United States, children that came here with their families, you know, within the past 5 years, they already have that history of trauma that affects their mental health. Now you have the pandemic, and in the context of the pandemic, in general, children tend to experience isolation at higher levels. They also feel the stress of their parents. We think, many of us, you know, parents probably had this, you know, like fell into this fallacy thinking, you know, faulted thinking, saying, oh, they are small, they don't understand. Oh, they do. They do understand it differently. They don't have an explanation, and the fact that they don't have an explanation for what happens, most of the materials that are prepared are not developmentally appropriate for children, increases their uncertainty. They are afraid. They experience the stress of losing a parent. They already lost their friends. They cannot have, you know, like contact with them. One of my friend's daughter, who is 5, actually, you know, they live in New York City. They were on the street, taking a walk, and she saw one of her friends, and you know, this is what children do. She ran to the other child to hug her, and both mothers screamed, and the child started crying. Well, this is a child that, you know, resorted to multiple naps during the day over the past 2 months, and that is a sign of depression. So, and we're talking about children in general. Now, when we're talking about children with a forced migration experience, they also experience marginalization and invisibility much more acutely during this pandemic. They were in school, you know, whatever happened in school, that provided them with a different environment where they were close to their peers, where they could study, right? When for many of these children, they were away for a little time from the parentification process that happens with many of these children that become, you know, like responsible for translating for their parents, for, you know, like being there for their parents, you know, fulfilling the dreams, you know, trying to do everything right because they don't want to add to the stress. Now that was taken away from them. They don't know when they'll be able to return to school. They see their parents extremely stressed. They are afraid of immigration services. They are afraid of being deported or having their parents deported. And I want to add one more thing. I know we're running out of time, and I don't want us to run out of time, but there is another entire group of children that we need to bring to the fore and really start thinking about that, because we are responsible for them. And those are the unaccompanied minors. The unaccompanied children, we have about right now 7,000 children in detention centers, immigration detention centers and shelters across the US. 7,000. Now, what happens when children are detained in such close quarters? Their access to basic protection mechanisms against the pandemic is limited. at best, right? What means to be, like when they experience symptoms, right? Let's say children get sick, and children did get sick in detention centers, right? So when children get sick, they are placed in quarantine. What means to be placed in quarantine in such a setting? It's complete isolation. And studies show that complete isolation of a child for extended periods of time is a form of torture. Now, I want you to think what we're doing to these children. Also, we are deporting children to countries that are not safe to them, where they have even less access to any kind of medical care. And we are doing this, saying we are containing, mitigating the pandemic, but we are not. We are just relocating it.
On a similar topic, we got a question in from the audience. Just give me 1 second. The U.S. has continued to send ICE flights to countries like Guatemala and possibly Honduras and El Salvador. This person read an article stating that at least 75% of these migrants on planes tested positive for COVID.
Yeah,
Could you speak a little bit about this?
Yes, and that's another example of how this provision is being used. And see, here is what I would like to have, a direct contact with the audience and see them and see their faces, because I wonder how many of them are familiar with the CDC order and what does it do, So this order was issued in March 20th, and it was actually created based on unearthing a public health policy from 1944. It was actually called Public Health Service Act, that was never meant to restrain, to limit immigration. It was meant to protect people against the pandemic. This is not how this is being used. This became a wide blanket for expeditiously removing people that are part of very specific groups, people that do not have documents and that are coming from Central and Latin America. It's very interesting, right? So in the process of expeditiously removing them, sending them immediately back with no due process to countries that really are threatening their lives, right? In this process, if you would really be focusing on addressing the risk for the spread of the virus, you would have some sort of monitoring. There is no monitoring being done of the disease. There is no testing being done. There has to be no proof that they might be infected. Not even that. They're just sent back, right? So yes, indeed, what this led to was deporting people to countries in the Northern Triangle that were infected and now brought the virus or increased the virus and the exposure to the virus in those countries. We must, take a break and pause and think, how are we really contributing to increasing safe spaces? Not only in this country, but in the region, at a global level. But we are not, talking politically, this administration is not interested in creating such safe spaces, right? We withdrew from the World Health Organization at a time like this, when it is important that and that does not only apply to the United States, all countries should start thinking, how can we come together to identify solutions that do not only patch broken systems that were set up to be broken in the United States. They didn't break, they were always like that. But we'll start reimagining all these reimagining policies on immigration that will be safe. Reimagining how can we create spaces in this country in which the color of your skin, the level of your income, the status of your immigration status, do not preclude you from accessing basic human rights. Mm-hmm. And when this happens, when we all start reimagining, we might be able to actually create better responses.
Now, immigrants are not the only group dealing with systemic inequality and injustice, obviously. Can you speak to the similarities between the plight of the immigrants and that of the Black community right now?
Wow. Absolutely. I think that, just by starting thinking of the terms we use and changing those terms, we can find more similarities than differences between different marginalized communities. People with lived experience of poverty, they're people. And they are not defined by poverty, but they live with this experience. People with lived experiences of homelessness, there are people like the Black community, people with lived, I wouldn't say Black community, I would say people with lived experiences of racism, you know, really trying to redefine and find that common element. Now, when you're talking about similarities between marginalization of these two groups, I think there are quite a few. Of course, you know, there are different histories, different experiences of trauma, but if you really think, both groups, you know, were historically, and even more so in later years, pushed to the margins. In social work, we talk about the web of oppression, right? You know, you use the intersectionality theory, and you see that there are different dimensions that keep pushing people to the margin. So race is one of them, ethnicity is another one, immigration status is another one, gender is another one, sexual orientation. So, you know, the more of these elements are present that are not identifying you with the dominant group, the more you're pushed to the margin. So for both groups, this was the reality. Look at poverty, you know, disproportionate rates of poverty among Black community and among the immigrant community, right? Particularly when we talk about forced migration, we talk about education and access to education. Again, disproportionate inequalities for both of these groups. We talk about access to healthcare and mental health care. You know, again, you know, little to no access for both of these groups. And let me bring it closer to home. We're talking about police brutality. Yes, this is something that is ingrained in our racist mindsets and racist policies, and it needed to be addressed. When you're talking about the immigrant community, you're seeing ICE brutality replicating the police brutality from profiling all the way on. And you know, in all truth, race remains a very important element in actually further marginalizing immigrants. One of my students yesterday asked about in my class, they asked about the migration protection protocols that are better referred to as the Remain to Mexico policy. And she said, why is that? Like, why are we only stopping people to come in to the United States and apply for asylum from Mexico? Why don't we apply the same rule to people coming in from Canada? And that leads to understanding the immigration policies, the visa waiver system, the refugee resettlement system, and understanding the political motivation behind it and the component of racism that is prevalent. So yes, there are similarities. There are similarities in the fact that the COVID-19 is disproportionately affecting the Black community. And the COVID-19 is disproportionately affecting communities that are inhabited by foreign-born people, right? So the migrant community will be affected as the same. So it's really interesting to see, to step back before the pandemic and see all the steps that we as a society took into pushing these groups further to the margins, leading to a much greater impact of the pandemic on them right now. But this was to be expected.
So if we say that systemic racism can cause trauma, what mental health resources do we have for people who experience that trauma? What can they do to help themselves?
Well, yes, I am a bit reluctant to talk only about what people can do to help themselves, because that kind of places the burden back on them.
Sure.
And this is a systemic issue that is caused by so many external factors that unless we start addressing the external factors, we cannot address, like the impact on the individual level. However, one of the most important things we all can do is to make sure that accurate and timely information is provided to people that need it most. And when I say accurate and timely, that means addressing all the barriers that exist right now. What information do we have? What languages is it in? When I talk about language, it's not only, like being in English, which, we try to address that, right? We try to have translations, but think of the professional lingo we all use, the language of oppression that's present in many of the materials that are, really meant to help people. So accurate information is needed. Why? Because we humans love to be in control. And even a small illusion of control is better than nothing. So providing people information that will help them think the next step is a very important first step. Then, like really how people can self-help themselves. So let me give you a scenario. Like we're thinking, okay, we need to recognize symptoms. We need to know what is happening. So one of the phrases we heard most for the past 3-4 weeks, but even before that, was, I can't breathe. I can't breathe, right? And we know what that is related to. But it is also something that we can talk about in the context of a complex emergency that affects the most marginalized. So here you are an asylum seeker living in the United States, in New York City, and all of a sudden you feel that you cannot breathe. Where is that coming from? Because even like trying to help people identify symptoms becomes much more complicated in the context of a complex emergency. So you cannot breathe because you're stressed, which will happen, which affects us all. You cannot breathe because all of a sudden, everything that's happened, the level of uncertainty, the fear for your life and for your children's life, that's much more real for this population, triggers past trauma. And, like that's a sign of PTSD, right? So I can't breathe. Is that it? Because then for each of these, you will have slightly different interventions. I can't breathe because of my ongoing asthma that was never treated and I cannot get access to healthcare for. I can't breathe just because I am infected. Or is it allergies? So really, I think more important than thinking how can we provide some tips for people to help themselves is to think, what can we do as a community to support people in such situations? What can we do to give them access to information, to increase visibility? Another similarity, let me step back a little bit, between the Black community and the discrimination they experience and the immigrant community is this paradox between visibility and invisibility that both groups are dealing with. On one hand, they're both invisible when it comes to policies. They are forgotten. They are not part of the conversation. They are not contributing their lived experiences. Therefore, they are not represented. Okay? On the other hand, when anything negative can be used against this population, visibility increases. So you have references to the migrant population that committed crimes immediately, or the possibility of refugees being terrorists. Where is this coming from? But we never talk about the contribution of any of these groups to the economy, to the society, to keeping us safe and healthy. So, so the first level is to create that visibility and be intentional about that by listening to this population, collecting stories, letting their voices be heard, right? The second step is you create awareness, talking about and providing information to professionals, to the wider public on the issues that I mentioned, right? On the new policy developments before they become enacted laws. We have all these temporary provisions. I am afraid because we have a tendency to transform temporary in permanent, right? So really creating awareness on what is happening and how people in these particular communities are disproportionately affected, and how by really creating a detrimental effect on a generation of children that already deal with discrimination and oppression, we are affecting us all. We might bring some change. And then the third level is, of course, advocacy and any ways in which we can support organizations that are already providing services, that are stressed to the maximum, that do not have the funds they need allocated to them. It's not enough to defund police. We also need to fund education, to fund social services, to really put funding into services provided to immigrants. That's how we contribute to an increased mental health of this population, because they will be able to then have some certainty, identify safe spaces, feel that they are recognized as people.
What policies do you think we can put into place to prevent another Black Swan event like this one?
Wow, but if I have the answer to this, I dare
No.
say, I'll be the next Nobel laureate.
Do you have any ideas?
I can tell you that one thing that struck me was the fact that we did have quite a few epidemics before, and there were a few World Health Organization statements, one referring to border closings and border closings not being effective in the case of epidemics. And somehow, once a crisis like this happens, we go back to a normal that's not normal, it's not the same, but we forget that we need to build strategies based on lessons learned to prepare us for the next crisis. So I think we have multiple issues here. Like when you're thinking about healthcare, one important lesson from this pandemic that we already knew, but now it became so much more visible, is that we have a very dysfunctional healthcare system, one that is not prepared. I mean, we were not equipped for this pandemic, and that became very clear. We are also leaving people out of accessing healthcare, while healthcare should be framed as a right. So really thinking of universal healthcare, it's one important element, right? What would that mean? Well, it would mean it would create access to healthcare for people that were left out, which means that existing conditions can be treated before they escalated, which means that they would have access to information, and they will also develop trust in healthcare systems, just not being afraid at a time like this to come forth and be tested and require treatment. Also not being afraid that the cost of a healthcare system will actually push them further in poverty and have them lose the little they have. So healthcare is one. The second one is education. We dealt with, like for the past few months, we dealt with the reality of the public education system. What happens is due to technological advances, we are able to quickly switch to remote learning. But when you're talking about remote learning, that's not equitable in any shape or form. And who are the populations that are left behind? The same populations that continuously have been marginalized, that already have educational gaps. And now they will be pushed further behind. So really rethinking the education system. What happens in case of emergencies? How do we make sure that connectivity is provided to greater numbers of people, to all, right? Then from there, you're talking about protection. What kind of protection policies can we put in place? I will start with children. We really have to review the way in which we define childhood, the way in which we protect children, the whole child welfare system that is overburdened and it's underfunded, but also thinking of other ways in which children's rights are at the center of children-related policies. And that means that, we will look at access to education, we'll look at access to nutrition, we'll look at access to care, we'll look at protections that children need in special situations, right? And that brings me to immigration. I don't know. I think this crisis gave me pause, and then one of the major activists against restrictive immigration policies that I have the honor to know mentioned this yesterday. We keep trying to fix the system, and that's great, and we go and advocate against policies, but we have to come up with a policy that's better. We have to start reimagining, how would an immigration system be if we take into consideration all these elements of fairness, making sure that people have access to due process. That doesn't mean that everybody can come in. That's the biggest fear that some people have. Don't worry, not everybody will come in. People that live well in their countries and communities will stay there. And even from the people that come in, not everybody will stay. We don't have a perfect country, not even close to. So let's try to think, okay, how can we address that? How can we ensure due process? How can we ensure a humane process in which when people are interviewed, they don't feel as criminals. They did nothing wrong. They don't feel that they will be thrown in jail for trying to save their families. Okay. So really reimagining immigration laws will be extremely important. And then of course, looking at employment and as it relates to the wider economy, we really have to stop and think, okay, some of the jobs that were lost might never come back. What does that mean? How do we design a society in which everybody has access to a decent level of living, to a decent standard of living. And no, it doesn't mean luxury. It means seeing the other person as human and knowing that they have great potential to contribute to this country, to contribute to the future, to contribute to my mental health.
Mm-hmm. And you said the key word, mental health. I wanted to circle back to that really quick before we finish up. How do we destigmatize mental health care? How do we get it in front of more people? How is it not something of the privileged and something that's, you know, more prevalent in schools and more non-English speakers are providing that service, and it's just more accessible to the marginalized people who could really take advantage of it?
Yeah, that's another big question. Why? Because mental illness, okay, and everything related to mental illness still carries a lot of stigma,
Right.
not only here, but in many other countries. And is seen as a disadvantage in accessing jobs, in accessing education, in being recognized for your potential in the society, even in this country. We're having a lot to work there. But, like going back to mental health and this concept of mental health, really understanding mental health as a mental well-being and reframing it this way. And then starting to identify, okay, if everybody has the right to mental health, mental well-being, what are the barriers that are preventing them from accessing those rights? Okay? Identify those barriers. Sometimes it's about the information, the way in which information is presented and delivered. Other times it's about the education of the community at the community level. How do we educate the public? Otherwise, is about accessing services and the impact that any kind of deterioration of mental health will have on you accessing those services. For migrants right now, a big issue is the whole public charge rule. People feel that if they come across as potentially vulnerable and becoming public charge for the government of the US, their entire immigration process might be affected. So it's multiple, again, it's all this web that needs to be addressed, but it is doable. It is doable.
Even being mindful of schedules, people that, are with their kids in the day, they work at night, when would they be able to see a therapist?
Thank you. Yes,
mindful
absolutely.
of that lived experience that you mentioned earlier.
And then thinking about, because like right now there is a big push for all this telehealth, right? But telehealth, when it comes to mental health, you really have to think it very carefully, because different population will have much more limited access, and they will be afraid to access it, and they will not be willing to talk. And how do you help them, right? So providing the right services with the right information. But I think even more important than that, and I will close to that if we don't have any other questions, more important than that is to really think of the fact that engaging people that are directly affected in designing policies from A to Z is one of the most important steps we need to take. Because we might think that some provisions increase safety and choice, but we think from a position of privilege and from our own experience. Yes, we go to school and there are many Fordham alumni here, and we get, we pay so much money for our education, so surely we should be recognized as experts. Unless you share the lived experience of the population you want to be an expert on, you're not an expert. I'm not an expert. But they can tell us, what does it mean to be safe? What does it mean safety? Shelter in place for the woman that has to take care of 3 children, but she has to continue working and her husband was recently deported. How do I recreate a sense of safety for that particular case? I don't know. Because I'm looking at the averages, and even the averages are not informed by the population themselves. So it is really important to engage people and have a conversation, meaningful conversation, not just as a token. Now, like we invite people just because it looks nice, no, but really intentionally engage them and let them educate us on how we can address all these issues together in a better way.
I think that's a perfect note to end on. Marciana, thank you so much. This was wonderful, very informative. A lot of great questions from the audience. Will your slides be available to people who request them?
I will make my slides available to people. And actually, just give me 2 more minutes.
Of course.
I want to share the work of 2 of my students, which is a flyer that I'm willing to share with participants that provides really good information, and it could be a resource for the population they want to help.
Mm-hmm.
And let me just, this is my, okay. So this is a flyer. This is the Spanish version. So we have right now a Spanish version and an English version. And basically it is a fact sheet of what is happening during the pandemic, particularly with an impact on the immigrant population in New York City. And what it also does, it starts by framing access to healthcare as a right, not to healthcare, excuse me, to all kinds of services as a right. And having access to protection is a right for all people. And then it also includes multiple resources, links to organizations that you all can support. I know we have all kinds of professionals in the audience, and I want you to all think, how can I contribute? If I have a computer science degree, how can I prepare, develop apps, design apps that will be accessible for people so they will provide information without feeling threatened, without feeling monitored, so we can get more information, going back to the role of the academia, directly from the people, information that could inform policies. If you are a lawyer, absolutely, like we need your contribution in not only understanding current laws, but thinking, how can we reframe them? How can we present these laws to the population that needs to be aware and familiar with them and how they work and how they are used? If you are a business person or an investor, please do think what you invest in. I mean, there are so many organizations that need support right now. There are so many entrepreneurial initiatives that are the only ones that immigrants can have access to. One of them being, like, for example, a catering business in New York. It's called Eat Off Beat, and it's fully staffed by refugees that are reframing, redefining, reframing, reclaiming their stories. They're providing amazing food, but they also introduce you to their stories. And their stories is not only connected to migration. It goes way beyond that. If you are in the healthcare professions, of course, there is so much there to understand how do we present different healthcare issues to people, information. How do we help them share their symptoms? How do we learn from them the most appropriate cultural language to share those symptoms? If you are a social worker, oh my God, I hope there are many social workers here. There is so much to do because we have a systemic approach that can actually look at a complex emergency and start identifying ways in which we can address each of the issues, removing barriers, but more important than that, really promoting and protecting human rights. And I'll stop here. I am more than willing to share this. My 3 students are amazing. Actually, 2 of them are, fresh GSS graduates, Anna Villasis and Amy. And we do have an undergraduate student that worked with us on that. And we are very happy to actually plan the translation of this fact sheet and add to it in multiple languages that are important for the immigrant communities in New York City and then beyond that.
Great. Well, I will definitely share that with everybody who participated today. So it sounds like if we can't walk a mile in their shoes, we should ask for their stories. Even if we're not lawyers or healthcare professionals, we're responsible citizens, we're humans, and we should treat people as such ourselves. So this is a great jumping off point. I hope everybody valued what you said and takes it to heart and makes their own action steps in their own lives.
Thank you. Thank you very much. And please stay healthy, stay safe, and focus on breathing well.
Absolutely. Thank you again, everyone. Have a great afternoon.